It is a privilege to be able to be with you and to offer these reflections on these earliest days of our fall semester. In this presentation, I wish to provide an overview of the journey on which we have been engaged over the course of these past 6 months as we have navigated through the pandemic, always seeking to place the health and safety of the members of our community first, and sustaining academic continuity and seeking to provide the very best academic experiences possible in a virtual environment, and to protecting the livelihoods of the members of our workforce. I begin in gratitude to all of you who have done so much to keep the spirit of Georgetown more alive than ever during this challenging time. From our colleagues in our medical center and our partners at MedStar Health, for the care you have provided. No system has cared for more patients in the Mid-Atlantic region. You are the frontline care providers, and your care has been superb. To our colleagues here in student affairs and facilities, our public health advisory group, our team in communications, our academic leaders, our 3 executive vice presidents, Provost Robert Groves, Dean William Traynor, Dr. Edward Healton, and all of our deans across our schools and campuses. To our operations team, led by Jeff Chattis, our senior vice president and chief operating officer, and Joe Ferrara, our vice president and chief of staff, for the countless steps that are required to sustain our mission. The list of colleagues to whom I am grateful is extraordinary. And to all of you, on behalf of everyone who is benefiting from your tireless efforts, thank you. And especially to our faculty. Under the most challenging circumstances, in the middle of a semester, you responded immediately to move to virtual learning and brought the spring semester to a successful close. You have embraced the challenge of teaching and mentoring in a virtual environment. More than 1,600 members of our faculty participated in workshops with Candles this summer. Candles, our Center for New Design and Learning and Scholarship, has provided an extraordinary resource for us as we have prepared for this virtual fall semester. And I wish to express my appreciation to our faculty leadership. Wayne Davis of our Faculty Senate, Kathy Olesko of the Main Campus Executive Committee, and Laura Donahue of the Law Center, George Luda of the Medical Center, and so many more. Countless numbers of students have been immersed in our deliberations and planning, and I wish to especially recognize the efforts of our student government at GUSA and GradGov for their hard work over this summer. And I wish to express my appreciation to our board of directors for the unfailing engagement throughout these past months, and especially over the summer, and especially the chairman of our board, William Doyle. And to our students and families, as we begin this academic year, we are grateful to each of you for this journey that we are about to embark together. In this presentation, I wish to share 3 elements that constitute the work over the summer. The decisions that unfolded in June and July, the public health framework that we have put into place, and how we are proceeding as we begin the fall semester. I will be back with you regularly throughout the fall, and we'll go into deeper aspects of what I will share with you now. So first, the decisions over the summer and the changing context for those decisions. There were 3 key decisions we made over the summer. We announced them in letters that I shared with you. First on June 9th, a second on July 6th, and a third on July 29th. Let me briefly take you through the arc of these decisions. On June 9th, I shared with you the framework through which we were framing decisions. I indicated that we would be guided by a set of 11 practical assumptions that I presented in the letter, always beginning with our commitment to health and safety. I also shared that our plans must fit within the framework provided by Reopen DC, the plan for the District of Columbia. We have worked diligently over the summer months with our colleagues from the team of our mayor, Muriel Bowser, in ensuring alignment with the city. A key assumption that I shared emphasized the differentiation of our academic programs. One other assumption I wish to highlight concerns the need for hybrid, flexible academic models. We did not want to require any member of our faculty or any student to have to come to campus this fall. We wanted to ensure every class would be hybrid, and that if we were able to offer in-person learning, neither the faculty member nor the student would be required to be in the classroom. We can't presume we know the conditions under which any member of our faculty or our students may be living, and the risk posed by being physically on campus. So we prepared for every class to be hybrid. Following this June 9th announcement, our campus academic leaders proceeded with plans to bring back to campus the research community on our medical and main campuses, and our students at the Law Center, Medical School, and Graduate School. On July 6th, a second letter outlined our intention to bring approximately 2,000 undergraduate students, including the members of the first-year class, and students with academic necessity to our main campus. On July 29th, I announced that all courses for all undergraduate and graduate students will begin in virtual mode. I indicated that due to the acceleration of the spread of the virus and increasing restrictions on interstate travel, we could not proceed with our original plans for returning to campus this fall. I know how disappointing this decision was for all of us. What were the conditions I was referring to? On June 9th, we as a nation were experiencing 17,000 new cases of COVID-19 a day. On July 6th, that number grew to 46,000, and on July 29th, 65,000. As you will remember, July was a particularly challenging month. There was what is called uncontrolled spread in 31 states. This uncontrolled spread led a number of states to limit interstate travel. Individuals coming from what were referred to as hotspots would be required to quarantine for 14 days upon entry into another state. Washington, D.C. was regarded as a hotspot, impacting travel for anyone coming from Washington. Washington also requires 14-day quarantine for anyone coming from 27 and now 29 states. And when you look at the states from where our undergraduates are coming, nearly half of our students would be required to quarantine for 14 days on arrival to campus. With that as background, we are virtual this fall until health conditions permit. We are not alone. Here in the city of Washington, Howard, GW, and American all also had to move to virtual learning environments. We do have under 500 undergraduates and under 100 law students at the Law Center who will be in our residence halls this fall. Students whose personal or family situation makes it impossible or unrealistic to pursue their studies at their permanent address, and a limited number of seniors whose graduation requirements and academic program necessitate an on-campus presence. And we are monitoring the conditions and putting into place the strongest possible public health framework in the hope that we will be able to bring more of our community back to our campuses. In many pieces of correspondence, we have presented elements of our layered public health framework. In a pandemic, it requires our best efforts to provide the safest environment possible. There are many layers to our framework. Elements include the Georgetown University Community Compact, attestation, self-screening for symptoms, temperature checks, hand washing, physical distancing, masks, testing, contact tracing, quarantine, isolation, deep cleaning of public spaces, and limiting crowd sizes. For the small number of our residential students and for the members of our research community who will be in their labs, all aspects of this framework is in place as we begin this fall term. I wish now to speak to two elements of the public health framework. First, the Georgetown University Community Compact, and second, our approach to testing. We have asked all members of our community on campus and in our local neighborhoods to commit to the Community Compact. Think of this as an expanded honor code for the time of the pandemic. The compact was developed in consultation with a broad range of members of our community. It represents the responsibility we have to accept for one another if we are to be in a position to return more members of our community to our campuses. These words appear on many of the 15,000 signs that are now up on our campuses. They capture this sense of responsibility we must have for one another. Testing raises some of the most vexing questions when confronting the pandemic. How much testing should be conducted? What kind of test should we use? How many times should one be tested? The answers to these questions are varied, and there is some disagreement among public health experts. For all of us in higher education, it became clear that if we were to be able to bring our community back to campus, we would need to be able to provide regular, widespread testing of an asymptomatic population with fast turnaround times, no more than 72 hours. Testing is the most crucial aspect of our layered approach. It is the only way to validate the presence of the virus. There are three different types of tests. First, the gold standard. And it's what is called a molecular PCR test. PCR standing for the scientific term, polymerase chain reaction. PCR tests look for evidence of the DNA of the coronavirus. This is the most common approach to testing. If you have been tested, it is likely it was a PCR test. Second is the antibody test. These are also quite common. Because they only look for the presence of the antibody to SARS-CoV-2, it can tell if you may have had exposure to the virus. At present, we don't really know what the presence of the antibody means, and it is not helpful in managing the public health of a university community. Third are what are referred to as antigen tests, and these are new and are just becoming available. 2 antigen tests have been given early use authorization by the FDA. Antigen tests promise faster turnaround. For Georgetown, we have a multi-layered approach to testing that we have developed with both a partner, One Medical, and with our colleagues from our medical center. The leader for Georgetown in developing this framework is Mark Fournier, our Vice President of Auxiliary Services here at Georgetown, who has done an outstanding job in developing and implementing our framework. All of our testing is PCR testing. As we start our fall semester, we're going to implement a framework where anyone who will be present regularly on campus will be required to be tested twice per week. We will offer the testing right here on our campuses. For anyone who attests that they may have symptoms, we will test immediately with a point-of-care testing machine made by the company Cepheid. We will use Cepheid machines for those tests, typically those with symptoms that require immediate turnaround. These machines provide capacity for about 160 tests a day, with turnaround times of less than a day and often within a few hours. Timing is crucial if someone may be infected with the virus. It enables us to begin immediately the contact tracing required to prevent the spread of the virus. And we will also be testing the members of our community asymptomatically, given how much we still need to learn about the transmission of the virus and the overwhelming evidence that the virus can be spread asymptomatically. We will be testing each member of our community who will be regularly on campus, again, twice a week. Here, we are supported by our partner, One Medical, who in turn works with a large national lab and a regional lab to analyze the tests and to provide us with an appropriate turnaround not to exceed 72 hours. And we have developed internal capacity to conduct some of our testing for the coronavirus. A team of colleagues, Spiros Dimolitsas, Peter Luger, and the leaders of our CW Bill Young Donor Recruitment and Research Program, our bone marrow lab, Carolyn Hurley and Jennifer Ng, have incorporated a new assay into their lab to be able to test for the SARS-CoV-2 virus. I can't begin to express my appreciation to Mark Fournier, to our colleagues at One Medical, to Spiros and Peter and Carolyn and Jennifer and their lab team for everything they have done to develop this framework for testing. In closing, just a word regarding how we are proceeding in these coming weeks. I will be back next week with some further reflections on our approach going forward. If there is one question that I receive most often, what criteria need to be met for us to take the next steps forward? When can we bring back to campus more of our community members? In a future presentation, I will provide more perspective. But for now, first, we need to ensure the success of our public health framework for these first weeks of the fall semester. This means compliance with the Community Compact, adherence to the new requirements, masks, physical distancing, limiting crowd gatherings. We need to ensure the strength of our testing program and our ability to identify those who may have had close contact with anyone who tests positive. We need to ensure we can manage the needs for both quarantine for those who may have had close contact with someone with the virus and isolation for those who have the illness. We will be monitoring the conditions here in the DMV, the District, Maryland, and Virginia. We are still regarded as hotspots. We still require anyone coming in from 29 states to quarantine for 14 days. The national numbers of new cases a day has declined from the peak of around 74,000 in late July to roughly 40,000 cases per day over the past 14 days. We will need to ensure we are meeting our obligations to the city as well as to our neighbors in the Georgetown Community Partnership. We will need to ensure that our workforce is able to perform under these pandemic conditions. We will be learning from the experiences of peer institutions across the nation as we all seek to deliver our missions this fall. I began in gratitude and I will close in gratitude. It has been more than a century since this university has operated within a pandemic. And I could not be more proud to be a member of this community than I am right now, as everyone has come together to ensure we respond in ways that bring out the best in each of us and all of us. So thank you for everything you are doing to ensure we can fulfill our mission. Wherever you are at this moment, please know how grateful we are for all you are doing in response to this moment.